The type of inhaler that I will be talking about is the Respimat. The Respimat is a unique inhaler that allows for aerosol administration for a patient who does not have the ability to suck medication out of a hand inhaler. The medication I will be discussing is Spiriva. Spiriva is an anticholinergic drug to help maintain the status of a patient who has COPD or asthma. The medication is to not be used with acute asthmatic attacks or to be used as needed. It should be used daily per doctor recommendation. Spiriva, like most other inhaled medications, can cause dry mouth, cough, constipation, nausea, vomiting, and a headache. It is important when you're taking Spiriva that you talk to your doctor about any pre-existing heart, kidney, or vision problems you might have. Spiriva can cause adverse reactions with blood pressure, heart, and heart rhythms. When you open your Spiriva Respimat inhaler, you receive an inhaler and a canister. It is important that when you insert the medication, you are working from a sturdy surface. Place the medication canister with the tinfoil top on a hard surface. Press the gray button located on the side of the inhaler to pop off the plastic covering. You should be able to see a thin needle. That is going to puncture the tinfoil top of the medication canister. Place the inhaler on top of this medication canister and with both hands push down until the canister is fully inserted inside the inhaler. This medication requires that you prime your device. 2 primes are accounted for in each canister. Priming means that you perform 2 inhaler actuations without actually breathing anything in. With one hand on top of the inhaler and the other hand on the plastic covering portion, perform a twisting motion. It is important to not have your thumb on the inhalation button as you may prematurely activate the inhaler. After a full twist, look inside your inhaler and you should see the canister is out further than it was before. This means the medication is loaded and ready for inhalation. Aim the inhaler away from your face and press the large gray button to release the aerosol into the air. You should see almost no to a small amount of particles in your first prime. Repeat the same action, except this time you should see significant particles on your second prime. Your medication is now ready for use. To take this medication, your first step will be to prepare the inhalation. Use the same technique as priming, except do not push the activation button. Make sure that the medication canister is jutting out of the bottom. Place your thumb on the big gray button, but do not apply pressure. Breathe out all air in your lungs, and then wrap your lips around the mouthpiece, creating a seal. Be careful to not block the air intake holes on the side. Press the activation button and simultaneously take a long, deep breath in. Hold the medication in as long as possible, preferably a maximum of 10 seconds, and then breathe out. Repeat this process according to doctor recommendation.
I'm going to talk to you about a push inhaler and how to use it properly. First, I want to provide some information about the medication used with the inhaler. The prescription medication used with a push inhaler is Albuterol, also known as Ventolin. It is used to treat and prevent bronchospasm or exercise-induced bronchospasm in people 4 years and older. It is a short-acting beta-adrenergic bronchodilator used for acute asthma symptoms. It works by stimulating beta-2 receptors to relax bronchial, uterine, and vascular smooth muscle. This results in bronchodilation, which opens the airways. Common side effects include sore throat, upper respiratory tract infection, cough, muscle pain, palpitations, chest pain, fast heart rate, shakiness, nervousness, and dizziness. Serious adverse reactions can include worsening trouble breathing, coughing, and wheezing, paradoxical bronchospasm, which is more likely to happen with your first use of a new canister of medicine. Additional adverse reactions include changes in sugar and potassium blood levels, faster heart rate, higher blood pressure, and serious allergic reactions with symptoms such as rash, hives, swelling of face, mouth, and tongue. Your healthcare provider should instruct you on how to use the inhaler so that you understand how to use it correctly. You should not increase your dose or take extra doses without first talking to your provider. When using the inhaler for the first time, you will need to prime it to ensure that you get the right amount of medication. First, you'll start by taking the cap off of the mouthpiece and shake the inhaler well. Point the inhaler away from your face and spray it 1 time into the air. Now you want to repeat this step 3 more times to finish priming. You will want to look at the counter on the device, and it should read either 200 or 060 depending on the size of the inhaler you have. You will also need to prime your inhaler if you have not used it in more than 14 days or if you drop it. If this is the case, you will need to take the cap off the mouthpiece, shake and spray the inhaler 4 times into the air pointed away from your face. Now I'll discuss how to properly use the inhaler. You'll want to follow these steps every time you need it. First, you will want to make sure the canister fits firmly in the actuator. You will know it is in properly when the counter is showing through the window in the actuator. It is important that you shake the inhaler well before each spray. You will take the cap off the mouthpiece of the actuator, and you want to look inside the mouthpiece to make sure there are no foreign objects. If there are, you will need to remove them. Next, you want to hold the inhaler with the mouthpiece down. Then you need to breathe out through your mouth and push as much air out of your lungs as you possibly can. Now, you'll place the mouthpiece in your mouth and close your lips around it. You will now push the top of the canister all the way down while you breathe in deeply and slowly through your mouth. After the spray comes out, take your finger off the canister. Once you have breathed in all the way, take the inhaler out of your mouth and close your mouth. Do not breathe out yet. You will want to hold your breath for about 10 seconds or for as long as it is comfortable for you. Breathe out as slowly as you can. If your healthcare provider told you to use more sprays, you will need to wait 1 minute and shake the inhaler again, and then repeat the same process. Once you are finished, you should put the cap back on the mouthpiece every time you use the inhaler and make sure that it snaps firmly into place. You need to clean your inhaler at least 1 time each week, and I will instruct you on how to do that as well. First, you'll take the canister out of the actuator and take the cap off the mouthpiece. Hold the actuator under the faucet and run warm water through it for about 30 seconds. Then turn the actuator upside down and run warm water through the mouthpiece for about another 30 seconds. You will want to shake off as much water as you can. You'll look into the mouthpiece to make sure any built-up medicine has been completely washed away, and if it hasn't, rinse it again. Once it's cleaned, let it dry overnight. Once it's dry, you will put the protective cap back on the mouthpiece and put the canister back into the actuator. You will need to shake the inhaler well, remove the cap, and spray the inhaler once into the air away from your face. Put the cap back on the mouthpiece. You're all set for your next use. Just a few important points to remember. The canister should always fit firmly in the actuator. You want to breathe in deeply and slowly to make sure you get all the medicine. You want to hold your breath for about 10 seconds after you breathe in the medicine, and then breathe out fully. You want to always keep the protective cap on the mouthpiece when your inhaler is not in use. And you want to always store your inhaler with the mouthpiece pointing down.
Hi, today I'm going to talk to you about the respiratory medication Breo or Lipta. This is a combination medication containing 2 drugs, a corticosteroid and a bronchodilator. They are used as an anti-inflammatory and a vasoconstrictor that can help to decrease inflammation and can help to relax smooth muscle. This is a beta-2 adrenergic agonist. It's a LABA or long-acting beta-adrenergic drug. It's used specifically as a maintenance drug, but not to handle any exacerbations with respiratory issues. This drug is used for the control of asthma or as a maintenance treatment for COPD. It comes in powder form for inhalation containing 2 double foil blister strips. One contains the fluticasone and the other one contains the Ventolin. When opening the inhaler, you should hear a click. This is the inhaler opening the blisters. You should not have more than 1 inhalation in 24 hours and should take the drug at exactly the same time every day. Make sure to fully exhale before taking 1 long, steady, deep breath through the mouthpiece, not through the nose. Hold breath for 3 to 4 seconds and exhale slowly and gently. After use, rinse mouth with water without swallowing to help reduce the risk of thrush. Make sure to store it at room temperature, away from heat and sunlight. This must be discarded 6 weeks after opening or when the counter reads 0. The inhaler is not reusable. Some of the known adverse reactions with this medication are headache, fever, hypertension, peripheral edema, runny nose, sneezing, oral thrush, oropharyngeal pain, diarrhea, abdominal pain, back pain, upper respiratory infection, COPD, pneumonia, bronchitis, and other flu-like symptoms. Contraindications for this medication are patients with severe hypersensitivity to milk proteins and those who have demonstrated hypersensitivity to this medication. You should be monitored for increased intraocular pressure and for the development or worsening of glaucoma or cataracts. Your provider should monitor you for hypokalemia as well as hyperglycemia. Do not exceed the recommended dose. Serious adverse events, including fatalities, have been associated with the excessive use of these types of drugs. You should not use this with other LABAs. You should notify your healthcare provider immediately if any of these adverse reactions occur or symptoms worsen. If more inhalations than usual or rescue medications are needed, or significant decrease in lung function occur, never discontinue this drug without the guidance of your provider. It is important that you obtain regular eye exams while on this medication, and female patients should report pregnancy to healthcare providers as soon as possible.
The Advair Discus inhaler is used for treatment of asthma and COPD. It contains two drugs, the steroid Flovent and the long-acting beta-2 agonist Ceravent. It is a dry powder inhaler and has 3 strengths available: 100 over 50, 250 over 50, and 500 over 50. The first number refers to the amount of Flovent, and the second number refers to the amount of Ceravent. It's generally prescribed 1 inhalation 2 times a day, at least 12 hours apart, and it should be taken around the same time every day. Because it is a dry powder inhaler and it's breath activated, it does not need to be shaken or used with a spacer. To use it, you're going to open the package and write the use by date on the discus. The use by date will be 1 month from the day it is opened. Then, holding the discus with your left hand, you're going to push the thumb grip in away from you with your right thumb. You should hear the mouthpiece snap into place, and then you can slide the lever away from the mouthpiece until it clicks. The counter should go down by 1. You should have received it with 60, so now it should be at 59. This indicates that it's ready for use. You should try not to tilt or flip the discus. Try to keep it as level as possible. Then, holding the inhaler away from your mouth, exhale as much as possible. Then, when you're ready to inhale, bring the inhaler to your mouth and breathe in quickly and deeply. You want to try to hold your breath for at least 10 seconds so the medication can get distributed. Then exhale slowly and close the discus by returning the thumb grip back over the mouthpiece. Because it has a steroid, you should rinse your mouth out with water and spit it out. It's important to know also that this is a long-acting medication and cannot stop an asthma attack or any acute symptoms. It should not be taken if you are allergic to any milk proteins, and it should be kept in a dry place, out of sunlight, and should not be washed. If needed, you can use a tissue to wipe around the mouthpiece. It should be discarded after the use by date, 1 month, or when the counter reaches 0, whichever comes first. Symptoms that should be reported to the healthcare provider after use include chest pain, dizziness, dry mouth, headache, insomnia, palpitations, tachycardia, and hyperglycemia.
So the purpose of using a spacer is to allow the full dose of medication to reach the lungs completely. A lot of times, especially with children, patients will find that they have difficulty fully inhaling all the contents of their dose, and what happens is that most of it gets deposited into the mouth instead of the lungs. Some medications that might be used with a spacer include bronchodilators such as Albuterol, as well as corticosteroids like Flovent. The patients you might see that require a spacer include children with diseases such as asthma, as well as older adults with COPD. So when you're using your spacer, you'll want to first make sure that your hands are clean. Then you need to inspect the chamber and make sure that that's clean as well and that there's no dust or foreign objects inside. Next, you're going to take your inhaler and shake it for 8 to 10 seconds to make sure that it evenly distributes your medication. Uncap it and connect the mouthpiece of your inhaler into the rubber port on the end of your spacer. You're going to hold the inhaler between your thumb and forefinger. Next, you want to sit up straight, tilt your head back slightly, take a deep breath in, and exhale completely. Now seal your mouth around the mouthpiece of your spacer and press the inhaler down. You're going to go ahead now and inhale the medication in as deep of a breath as you're able to. You don't want to inhale it too quickly. The spacer will actually make a whistling noise if you do take a breath in too fast, so your goal is to inhale without letting the spacer make any noise. You're going to hold that breath for 10 to 12 seconds and then remove the chamber from your mouth and exhale slowly. Some important things to keep in mind would be to make sure that you're cleaning your device regularly, about once a week. You should rinse your spacer with a small amount of dish soap and water, and then make sure that it's rinsed off with clean water after that. You can place it on a paper towel to let it air dry. Also, when you're using a spacer, it's important to only press the inhaler down once per inspiration, waiting at least a full minute between puffs of the same medication. Just make sure that you're following your doctor's orders regarding dosage and frequency. And then lastly, if you're using a medication that does contain a steroid, just make sure that you're rinsing your mouth out afterwards in order to prevent thrush.